What you know about Tinnitus Masker? Have you ever suffered from wheezing or buzzing in the ear? It's actually tinnitus. There are two types of tinnitus. Objective tinnitus are very rare and mainly related to existing noise. This tinnitus originates from a real noise in the ear, following an anomaly in the cochlea, the organ of hearing. It may be a malformation or lesions, and in this case, surgery is possible to remove them. Subjective tinnitus are very frequent. They often appear with hearing loss due to age, or repeated exposure to noise. But they also often depend on various psychological factors, depression, stress, etc. What to do when tinnitus appears? To help in this direction, multidisciplinary teams composed of ENT specialists, psychotherapists and hearing aid practitioners have been set up. Tinnitus is, therefore, attacked on several fronts with a clear possibility of overcoming it more easily. Some people, when they are victims of temporary tinnitus or not, often imagine the worst: tumor, mental problems, or a total and irreversible deafness. Fortunately, as mentioned above, this is very rarely the case. However, it is very important to first consult your general practitioner, who will recommend, after examination, a visit to an ENT. This specialist will rule out any serious cause of tinnitus and will reassure you that it is benign. It will also propose the most appropriate way to help the brain to get used to the habituation phenomenon. There are sometimes effective treatments for the causes of tinnitus, such as the extraction of an earwax plug. What are the actions that help in daily life? Avoid loud sounds such as drills, rock concerts or motorcycles as much as possible, and wear plugs or headphones when confronted with them. Avoid silence, prefer background noise. Do not isolate yourself and continue to lead a social life by being helped by patient associations or discussion groups. Avoid the consumption of alcohol and existing products such as coffee or tea. Report tinnitus to the doctor to avoid the prescription of so-called ototoxic drugs that could amplify it. Practice a sport such as yoga to help relieve stress. Tinnitus Masker temporary relief. Quickly, do you want relief from the constant buzzing in your head? Imagine yourself sitting next to a beautiful fountain. Can you feel the easing of tensions as you listen to the melody that is in the sound of the water? The sound of water was one of the first tinnitus maskers to mask tinnitus. You can try this for yourself. Open a tap slowly, and as the flow of the water becomes stronger, you will feel your tinnitus fading to the bottom. If the test is successful, you are an ideal candidate for a tinnitus masker. While a tinnitus masker is not a cure, it may be the best way to relieve you of this irritating and hopeless condition in the next half hour. There are many products to mask the sound of ringing in the ears or tinnitus. You can buy an MP3 CD with water sounds or what is known as white noise. There are devices that reproduce recordings of natural forest sounds and soft music while you sleep. There are also hearing aids and devices such as hearing aids that can be worn during the day. Let's discuss the types of portable maskers you can get and use. There are three categories. Tinnitus Masker. Tinnitus Masker 1. Hearing aids can help people with tinnitus and some level of hearing loss. The brain is used to a certain level of noise. If something is missing because of the brain's hearing loss, it fills it with that certain ringing or buzzing that we are all familiar with. Another reason hearing aids work is that other background sounds are amplified to drown out the ringing in the ears. Tinnitus Masker 2. Active masking devices help people who do not have hearing loss. The brain can learn to ignore tinnitus sounds if it has something else to concentrate on. These masking devices work by providing a masking sound to hear instead of tinnitus. Some of the newer maskers can be tuned to the tinnitus sound of individuals and do a better job. For a few who suffer from ringing in the ears and can be kept at a lower level after the masker device is turned off. They call it residual inhibition. Silence can last for a long period of time, and for others it is only a brief relief. There are also instruments that combine the amplification of a hearing aid with the masking sound of a masking device. It seems that it is best to work with the hearing aid or masker alone. This way it is better to help you fall asleep better at night. The user may experience residual inhibition when the device is turned off at night. Otherwise, the amplification can be turned off while leaving the masking sound on. It is best for both cases. It is advisable to use a tinnitus masker for relief in working towards a permanent cure by some other preferably natural means. There are many natural treatments that when taken together can obtain permanent cure by attacking the cause of tinnitus.